Welcome to the Data Protection Network Associates webinar sponsored by OneTrust Privacy. We're going to be talking about, has COVID-19 changed our attitudes to privacy? You see your panel before you, and I'm going to introduce us in a moment. But I think, Simon, if we can move to the first slide, and I'll just take people through. So there you are. There is the topic. And if we could move to the next slide, I just wanted to say a few words about our sponsor. Obviously, you can see all this on the screen, but OneTrust is the #1 fastest growing and most widely used technology to help organizations build more trusted privacy, security, and governance programs. More than 7,500 customers, including half of the Fortune 500, use OneTrust to comply with the CCPA, GDPR, LGPD, ISO 27001, and more. So we're delighted that OneTrust is sponsoring today. I'd like to move on to the panel, if I may. I'm just going to say a few words about myself and then I'll pass over to the others. I'm Senior Counsel and Notary Public and a Compliance and Ethics Professional with Bristow's law firm. I've been dealing with data protection and information security since 1983, and I'm delighted to be Chairman of the Data Protection Network Advisory Board. So enough from me. Simon, I'll hand over to you.
Hi, good afternoon, everybody. Hi. So my name's Simon Blanchard. I'm a partner at the Data Protection Network Associates. So for those of you that are new to us, DPN, I'll tell you a little bit about us. We're a thought leadership network and consultancy. We publish topical articles, how-to guides, insight papers. We run events like this to help businesses to manage their data and their data protection obligations. So most of our content is free for you to view online as well if you want to have a look at the website. We also have a data protection consultancy arm which helps businesses to solve their data challenges. We have a lot of commercial experience working with blue chips, SMEs across multiple sectors, and we take kind of a no-nonsense approach, we like to think, to provide real-world support and advice. We also provide practical interactive kind of workshop training to develop teams' skills and understanding of privacy matters. Regarding kind of me personally, I've worked in data roles kind of all my career. I've been, my previous role was head of data and online at a large publishing company. I was at Bauer Media before I moved into data protection consultancy 7 years ago. And delighted to be on the panel today, Robert.
Thank you, Simon. And delighted next to introduce Helen Brown. Helen, if you'd like to say a few words about yourself.
Hi everyone, good afternoon, and thanks very much for inviting me onto the panel. I'm Helen Brown. I started my career in the NHS as a health statistician and focused on leading teams that used complex health information to improve population health. About 10 years ago, I took a national lead role in data and intelligence improvement for the NHS to understand how data could be used better for the NHS to deliver its strategic objectives. Leading many projects which influenced policy, worked with regulators and supported many organisations to address their multitude of challenges with their data and governing access and use of their data. I've recently left the NHS and I've set up my own company, which is In the Know Limited, because I really wanted to help companies get the most from their data assets. And I felt like I'd learned so much over my career that other industries could benefit from. So I now provide e-learning training and consultancy services to help companies get the best utility from their data whilst also addressing their regulations, legal, contractual and commercial sensitivities and ethical considerations in their data.
Thank you, Helen. And finally, Joe Byrne with OneTrust. Joe, over to you.
Thanks, Robert. Yes, I'm Joseph Byrne, Privacy Solutions Engineer at OneTrust. I've been in the privacy space now for just approaching 2 years, and I've achieved 2 of my privacy qualifications for privacy professional and privacy manager from the IAPP. My role is really a combination of things. It's understanding the privacy laws and legislation, and then showing organizations how they can use OneTrust to meet a lot of those challenges. And outside of that direct role, I also speak on a lot of panels and present at a lot of events on current topics in privacy. And I really enjoy that aspect of the role. It's educational, but also when you get onto a panel like this one, you also learn a lot from the other people that are on there. So delighted to be here today, and hopefully I can provide some insight as we progress.
Super, thank you. So Simon is going to take us through an overview of the topic and the subtopics that we're going to talk about today. We do have a polling question that we'll be coming to in due course. We've had a lot of questions that have been sent in, which we'll be coming to towards the end. But we are going to go mute and video off just to improve bandwidth now. And I think, Simon, I'll hand over to you.
Great. Thank you very much, Robert. Yeah, so as Robert said, I'll just kind of do a bit of a scene setter for you now. Just turn my video off there and take you through this. So just kind of to introduce the whole topic, obviously we're talking today about COVID and the impact on privacy and really how it's affected people's attitudes. So since the arrival of COVID-19 to our shores kind of early last year, we've seen huge changes in our way of life. It's been necessary to adopt a wide range of measures to control the spread of the pandemic, from measures that we all need to take, such as washing our hands regularly, wearing a mask, social distancing, all the things we're very familiar with, through to COVID testing centres, contact tracing, the national lockdown, the requirement to work from home if we can, and now, of course, the rapid rollout of the vaccination programme, which has now reached, I believe, 17 million people. So many of these measures, whilst they've been necessary, have imposed kind of severe restrictions on the levels and freedoms that we normally enjoy in our home lives, at work and in public. So today we're actually going to focus on the ways that personal data, and in many cases we're talking here about special category kind of data regarding health, of course, the way that data has been used to kind of combat the spread of the pandemic, but also in other ways to kind of keep the public informed, keep the public well informed, and to ensure that our precious healthcare resources are deployed in the very best possible ways. So important things to us all, I think. So here's kind of a short summary of the things that we're going to cover. There's a slide that you'll see on screen here about attitudes. This is just a very general overview, really, to be honest, to illustrate people's attitudes to privacy can vary. This image actually was created out of some research done as far back ago as the 60s, in fact, but it's still used quite widely today, and in this case, the image from the Direct Marketing Association. But it's broadly identifying 3 groups here. So there's the unconcerned, who are the people that aren't concerned by the collection and use of their personal data. And in the middle group, we've got the largest group there, the pragmatists, who are prepared to kind of make trade-offs for their data, provided they get the services or other benefits that they value in return for their data. And then on the other side, we've got the fundamentalists, which is the people who are generally unwilling to provide their personal information in return for service or product kind of enhancements. Now, they're the ones that can be hard to win over. And perhaps there should be a 4th group. This is something that Robert pointed out and we talked about before. Perhaps there should be a 4th group here, the uninformed, which obviously is another group that we should be considering here. But the purpose really of this slide is simply to illustrate that attitudes to privacy do vary. There are different groups, and we, as businesses and as organisations, we need to recognise this, and we need to be prepared to accommodate the privacy kind of concerns of all the mindsets that people have, including the fundamentalists, who might need a lot of reassurance and a lot of explanation. So we'll come back to this in just a few moments. Let's just go through some of the other things we're going to talk about today. So we'll cast an eye overseas, and we'll consider how attitudes and expectation of privacy can vary across the world. We've got some examples here from South Korea and Australia. We'll also talk about collecting and using health data, the challenges really around collecting and using public health data, and discuss the role of government, the NHS and other health and care organisations. We'll talk about who do we trust with our data. And this chart just gives examples showing the that people have become more familiar. Sorry, that was the one that was previous. What we're going to talk about here is that this chart will show that actually people's levels of trust in healthcare are relatively high compared to government and other financial institutions. You can see kind of on the left there that the public's general trust that healthcare services will use their data only for the purposes that they stated is higher than kind of government, financial institutions, online retailers, search engines, etc. So there is good levels of trust that healthcare providers will use it just for those purposes. We'll talk about if there's a tension between public health and privacy. I think that's one of the key things we're going to talk about, and also thinking about kind of the way that information is communicated to people to encourage trust and transparency. We'll also talk about kind of health data collected by employers, which is in lots of different ways that data is being collected through the course of the pandemic, and talk about kind of what kind of safeguards are required. So this is things like, by the way, sort of things like information on diagnoses, symptoms, personal travel and temperature checks and things like that. So quite a variety. And finally, we're going to talk about working from home as well, and some of the challenges that so many people moving to a working from home environment from previously working in the offices, obviously, is what challenges has that caused us from a point of view of information security and privacy. Okay, I'll hand back to you there, Robert.
Thank you, Simon, for setting the scene. Before we get into discussion as a panel, we wanted to ask you to help us with poll question that we've got. So I wonder if we can bring up the poll question. Can we, Simon?
There we go. You should be able to see it now.
So just to confirm it, in the past year, have you been more willing to share data for public health reasons, more willing, less willing, same as before? And I can see as I'm talking that everybody is very kindly responding. The numbers are swinging about a bit, but it broadly seems to be indicating either more willing or same as before. I'll give us another 5 seconds or so. I think we're pretty much there. If we end the poll, it's looking like 45% of us are more willing. Only 6% are less willing, and then 49% pretty much the same as before. I suspect that's what we would have guessed ourselves before we asked the question, but I do appreciate you responding to that. So what I wanted to do now for the next 45 minutes is go through the questions that we've had in and to get feedback from us on the panel. So I guess we should probably put our videos back on for this part. Thank you. Everybody's there. Good. Oh, and by the way, I should also say, do feel free to send in questions as we go through, and we'll try and fit those in as well as the questions we've had in advance. So the topic is, have our attitudes changed? So I'm going to start with Helen, if I may. What do you think, from your expertise and experience, are our attitudes now to privacy as a result of COVID-19, Helen?
Oh, okay. Well, I think COVID's really demonstrated the true benefit of how the NHS has effectively used data to provide, healthcare organisations, the government and the public, analysis updates, and also how they've used technology to deliver online appointments. I think by necessity, the NHS has used significantly more sharing of confidential data during the pandemic, and that's been supported by the emergency powers of the COPI laws and regulations. I think that there's now a greater expectation that the health organisations will use this integrated analysis for wider health issues going forward as a result of COVID, because the NHS needs to be able to respond to future events. But I'm not sure that there's a broad understanding out there by the public that healthcare organisations don't regularly share all of this data across their organisations, and that when the pandemic's over, some of this data will be switched off unless there is some sort of change in legislation. So I think in summary, I'm really hopeful that COVID will have helped educate the public, and now we may have a better balanced approach to sharing of data and enable healthcare organisations to use the essential data for the benefit of the population.
Thank you. And Joseph, obviously Helen's talked about the healthcare NHS, and by all means, I'd like your views on that. But again, a lot of the health data that's been used is also not just by the healthcare sector, but by employers and so on. So what are your views?
Well, I think the COVID pandemic in particular really brought the value of personal information into much sharper focus. It's been an increasing trend for the past few years that data subjects have become more aware of this, and that's partly due to legislation, it's partly due to some high-profile breaches, and it's partly due to a big increase in media coverage. But COVID really then became a catalyst to this, because obviously organisations like the government, the NHS, were requesting this data. So I think now more than ever, people are more aware of the value of that data, and now they're perhaps making more measured decisions as to whether they consent to it or not. And I think the level of scrutiny all that came under would have been a lot less maybe 5 or 10 years ago, when people weren't so perhaps aware of the value of their personal data. So I think in terms of attitudes, it's further increased data subjects' awareness of their personal data and its value. And with that, they've made more reasoned decisions about who they're going to share it with. And I think, especially when it comes to sharing with the NHS, maybe they've even been more willing to share that because they understand that it's being used for a good cause. And maybe they've also read the terms and conditions now, rather than perhaps a few years ago they may have just dismissed or clicked accept.
Yeah, very good. And just as you were talking, we've had a question come in which is very relevant to this item, particularly what Helen was saying. So Helen, I'm throwing this one at you without any prior warning, but a very good question said, do you know if there's been any guidance from the government as to what the retention periods are for the data that is being collected, for track and trace, for border control, vaccinating, etc.?
No, I don't know personally, because I've left the NHS. But it will be what's reasonable. It won't be kept longer than is necessary. And
I think it's something that we talked about when we were planning this webinar, that of course, while we're doing all these good things, we have to remember the basic data protection principles about transparency and accountability and data minimization and all those sorts of things. When I talk about we, I'm sort of doing this as we sitting here in the UK, but I'm interested, Simon, do you think that cultural differences play a part? Are we more skeptical here than elsewhere, or what do you think is the cultural stuff?
I think you're right. Yeah, it's interesting to see kind of how this has played out kind of at a worldwide level. So if you compare kind of the UK's experience to somewhere like South Korea, for example, where there was a stricter kind of track and trace kind of regime there and stronger controls in place and the communication of that data. So, for example, they were using a mixture of things like phone data, surveillance cameras, credit card histories, etc., to be able to track people's movements. And I think doing things like that actually have potentially, have had a benefit in terms of the way that they've seen their case levels reduce. But the question is, would the British public, for example, or in fact European public, accept kind of controls on their privacy like that, and their privacy being used in that kind of way? So I think there are differences both in terms of people's attitudes and expectations around the way that data will be used. And I think that's kind of shaped the way, to some degree, the way that data's been used through the pandemic and the different kind of global approaches that we've seen.
Thank you for that. Yes, thank you. And Simon, I'm sorry, and Joseph, I mean, you know that there are certain European countries where history dictates that they are more protective of their privacy. But do you see that changing with the current pandemic and the use of data at all?
I think they're still going to be perhaps reserved in that respect. And to the point about sort of cultural differences, certainly in Europe, I think people are more aware of their freedom, and they maybe value those things a bit more, and they're more sort of used to doing maybe more what they want rather than what society deems is a good idea. And a simple example, a friend of mine who I grew up with in the Netherlands, she's Taiwanese, but she lives in Japan now. She's lived there for about 10 years, and she came to visit me summer before last, and we were walking around and we went and did some jaywalking and things like that. And she said, this is ridiculous because people are walking all over the road, and they simply don't do that in Japan. And that's because they've put a system in place for your own safety. But in perhaps Europe, we think, well, that's a nice system, but we'd rather do our own thing. So it can make a huge difference, I think, culturally from there. But I think with regards to different parts of Europe, the countries that are still anxious about their data, they still want to manage it within perhaps their own borders. With regards to the pandemic, they can still do that. But I've sort of seen in general where some of these countries are working with their privacy data, they always would prefer if it was hosted in a data center that's within their borders. So I don't think that's changed significantly due to COVID, but I certainly think cultural differences play a part in how cooperative people are.
Okay, thanks. And Helen, anything to add to the cultural question?
I think a lot of culture comes down to people's trust, and I think that it's really important that countries across the world are really clear on what their data is used for, how well that's governed and managed. And it can be difficult for people to understand those simple messages as to how data is used, and that in itself doesn't brew trust really. But as a health service in the UK, I think we've got separation from our government, which promotes independence, and the health service doesn't sell confidential data to external companies. Whereas across other countries, you've got private organizations where they provide healthcare, and maybe their use of data is shared more widely with insurance companies, or alternatively, you've got other countries where the political structure is such that people wouldn't comment on how their data is used. So there's a real lot of things which are influencing, sort of like the culture of how data is used. And trust, I think, is a really big one, with transparency and education. And given we've got a multicultural population, I think that does influence how the culture of how much trust people have got in the use of our data across our country and across others. So I think all countries have got a mix of similar but different issues depending on their backgrounds.
Thank you. And actually, again, while we've been talking, there have been quite a number of comments coming in on the chat, which are tending to raise question marks, different questions about whether we do feel that the way our data is used is actually something the public is even aware of at all. And so one of the questions that we've had is, how important is it for the government, public health bodies, indeed businesses, to get their communications right and explain clearly how data is to be used? I'm going to start with you, Joseph, on that one.
Well, I think it's absolutely essential, and it's one of the fundamental parts of the GDPR under Article 4, that consent must be freely given, specific, and in particular for this question, informed and unambiguous. So if you intend to process this data, the first question people will ask is typically, what are you going to do with it, and for how long? And if you can't articulate that clearly, you'll immediately arouse suspicion with those data subjects. So we need to be building confidence, not suspicion. And from my experience, the government are fairly good at this, building confidence. In particular, the government websites and the NHS are very clear and unambiguous with regards to their explanation. So I think they're doing a good job there. But that explanation is essential, that it's clear and unambiguous.
And yeah, I'm actually going to come to Simon on this one. What are your thoughts? You're on mute, Simon.
Sorry, just trying to stop any feedback. Hi, hope you can hear me now. Apologies. Yeah, I quite agree. I think the watchwords here really are, trust and transparency, or in fact, providing transparency so that you can build that trust. We do need to be absolutely clear, completely agree. I do think that kind of sharing data for public health purposes very much is a good thing, and it's good to see actually from the poll that people are recognizing that. But I think a lot of it, the one thing that we probably haven't talked about so much is about how that information is being communicated and how transparent that it was originally at the start of the pandemic, compared to how it is now. An example of that, I think, was probably the original kind of track and trace app. And the communications around that, around what the data would actually be used for, were maybe not particularly clear at that time. And there certainly were some concerns I've heard from people about whether my data might be used for some other purposes. And there was just a bit of a lack of transparency around that. And the message, frankly, didn't come across particularly convincing, I think. So from that point of view, I think that potentially damaged a little bit of trust at the time. We didn't get the take-up that was needed, really, around the app at that time. The number of people downloading and using the app was relatively low at the time, compared to when that's been relaunched with a very clear message. I think we've seen quite big improvements. We've seen about 21 million downloads now. I appreciate there's still some way to go to reach the whole of the population here, but we're in a much better place now. So I think it's not just about being transparent; it's being about able to communicate that message. And again, which takes us on to who we appoint as our spokespeople and who we listen to and who can be compelling voices at a time like this.
Thanks, Simon. And any comments on this, Helen?
Yeah, I think I agree with everything everyone said so far. One of the things, though, where you've got really large organisations like the national organisations, and they use data for so many purposes, and all of those purposes are really complicated given the web of organisations that exist and so on. One of the things that health organisations have done is run things called patient juries. And these have been sort of like workshops where people have had presentations as to how the data is used, and they've polled people before they've gone in and when they've come out, and actually the take-up of people's understanding of how data is used is so much better. And the results are that people are largely really supportive of the use of healthcare data from using that methodology. I think that healthcare organisations really do struggle to be able to get those messages across, just because they're so vast, and the purposes for which they use data are so many. So yeah, I think that's a really great way of sort of like polling people to address that issue.
And I'm just going to add my thoughts here in conjunction with, again, some chat that's been coming in, and that is that because, like some of our other delegates here, we read privacy notices because we're sort of geeky type people. I'm not convinced at all that we have got anything like the transparency that we should have had in terms of what happens to our data, even before COVID-19. And I'm sure that there will be lessons learned post-COVID-19. I also worry about function creep and whether the data will drift off into other bases that are not directly related to the very good reasons that our data is being used for COVID-19. Not that it's to do with the NHS, but certainly we've seen plenty of examples in the media of where track and trace details, when we were allowed to go into pubs and so on, was being used by the guy behind the bar to send SMS messages to the girl that's just logged in, etc. And I do wonder what is happening to that data and whether there is the depth of concern with some of the organizations. And obviously, there's the ICO and many others are asking organizations to be much more focused on data sharing agreements. Yeah. So I think we're all learning on the hoof, so to speak, as we go through this. Again, some of the chats that we've had has been, I didn't think when I gave my doctor my mobile number that this would then cause me to receive numerous text messages telling me to go to a walk-in centre. I suppose I should have anticipated it, but I don't remember seeing anything anywhere that said that this would happen. Is this actually marketing, or is it a service communication type thing? And I generally think that messages we're getting from health centres and doctors are not marketing. They are not doing us any damage. But I think in the round, we need to be thinking a bit more about what's happening to the data, how long we're storing it, what methods we're using for securing it. And I'm just reiterating some of the comments that I'm getting in from the from delegates as we're going through. So if I can now turn to, and I mentioned businesses. Businesses have got all sorts of challenges collecting data about their employees, about contractors and so on. Simon, what are you seeing as the type of data that's being collected during the pandemic, and for what reasons, and how is it justified?
Yeah, so there's a range of them, Robert. Actually, I think I briefly showed it on a slide earlier, but let me take you through kind of some of the highlights there. So this was actually a survey that Ernst & Young did. It's a global survey, by the way, I should point out. But what it was showing kind of for working from home, nearly half of the organisations, it was about 45% that were in that study, had adopted new technology or contracted with a new vendor to enable remote working due to COVID-19. So that might have been for different reasons, maybe improving their security, their information security, or other reasons to enable people just to work from home. 60% of businesses were keeping records of employees that were diagnosed with COVID. But interestingly, there were 30% that said they were unsure. That only leaves 10% that were saying no, effectively. So that's quite interesting. So there's quite a lot of businesses that are keeping records of employees who have been diagnosed, probably not surprisingly at all. More than half of employers have collected data from their employees about symptoms as well, and also about personal travel. Interestingly, that came up quite high as well. Employees asking about personal travel arrangements that people are making. And 23% have been taking the temperature of employees as well that were coming into the business as well. And again, we might expect that actually that doesn't seem such a high number, but of course there's not so many employees that are going into the work office, so it's probably not so surprising, I guess, that it's a smaller number. So being used for various purposes, and I think some of the key messages to point out to people is that, and again in line with kind of the guidance that the ICO provides on this, it's important if you're a business that's considering capturing more employee data or starting to do that for COVID related reasons, you should first of all carry out a risk assessment. Make sure that you carry out a risk assessment, because I think it's true that you do, as employers, we have a duty of care to protect individuals, from others, but that doesn't mean that we do have to still abide by things. We still have to be transparent. We still have to make sure that we've got these measures and protections and that we're not keeping data too long, all of those kind of things in place. We've also got to think about what the lawful basis is, and there's been some guidance about that. I think, as you mentioned, Robert, some of that processing might be based on public interest or legal necessity. So there's some guidance, again, that's been made available around what the lawful basis for that kind of processing might be by employers. And again, just making sure that we adopt all the measures that are necessary to protect that data and only keep it for as long as we need it, and that it's proportionate to the needs as well. So,
okay,
I'm back.
Yeah, thank you for that. And I suppose, and I'm going to just ask Joseph to comment on this. We assume that we can do this because there's some lawful ground, etc., and it's personal data. But we mustn't forget that there are other laws as well, some of which help us do this. But, in some jurisdictions, labor law and so on is actually something that we have to think about. And again, Germany is a very good example where with works councils, you're not just going to be able to do this. And I don't know whether, Joseph, this is something that you've been looking at.
Well, certainly works councils in the German region, privacy-wise, seem to be involved in everything. I mean, we talk about that internally as well, that if we have a meeting there, it's highly likely there'll be a rep from a works council there too. I think that poses additional challenges as to whether people do want to share that data. And I think for any business, as we spoke about earlier, or Simon mentioned, they need to weigh up the risk, not only the risk of capturing that data, but storing it, and also the legal implications of perhaps having it. And if it poses too much of a demand or challenge, then maybe employers should consider then prolonging the periods for working from home for people that aren't interested or refuse to provide that data, if it's going to pose a risk to the business internally with regards to the virus, but also with regards to managing that data. So that's something I think they would need to consider as well. But it's definitely not straightforward, and I don't think everyone will be willing to share that data. And a lot of that data is considered as part of the sensitive categories of data within the GDPR as well, which I think poses a greater risk.
And I suppose there is a risk if we all start coming back to work, that there are going to be differing attitudes between people who are in the same space, the same office. I am not going to go to work if he is going to be there and has not done X, Y, and Z. And then you're going to have somebody saying, I want to do A, B, and C, but I'm now being discriminated against. Is this something, am I being dramatic, Helen, or do you see that sort of thing happening?
No, I absolutely think it will happen because, people are frightened of getting the disease, aren't they? But, it's really important that there's a balance. You could take flu jabs, nobody's mandated to have a flu jab, but, people, even in hospitals, have to go and treat people with flu. But if it was Ebola, would you allow people that haven't been immunised against it to go treat people? Probably not. So it's somewhere else in the middle there, isn't it, with this disease? And I think the government should give advice on how this should be tackled. And it shouldn't be left to have different organisations making different decisions on this. I think it just caused too many problems.
And I think there'll be a lot of suspicion as well. And when everybody does, if they do all go back to work, I think a lot of people may get ill from general illnesses anyway, just because they've not been in the proximity of each other. So when I was younger, I went to international school, and my mother worked in the international school, British school in the Netherlands, and they called it flu season, which was at the end of the summer holidays, the first term. Everyone in the entire school got ill because everyone had gone everywhere for the summer holidays and all descended back. And I think maybe not to the same extent, but when everyone does pile into work, I think there's going to be a lot of that around, not necessarily COVID, and I think that will make people even more anxious.
Can I just add, I think we've got one of the more biggest challenges coming, if I'm honest, is around vaccinations, and have you been vaccinated or haven't you been vaccinated? because we've got that challenge where employers looking to ask the workforce, have you had the vaccine? We're going to have people that have chosen to refuse that or choose not to say. And we've got situations whereby that can be a challenge for an employer who has a duty of care, particularly, if they work in a care home, for example, or if they're frontline workers in some way that have a contact with many other employees or with the public. So, of course, people have got the right to refuse a vaccine, but equally, an employer's got has a duty of care, and therefore will want to ask. So, I think that presents quite a challenge, actually, that we've got coming up.
Yeah, and actually, if I can jump in there, Simon, one of the questions that we've had is, my organisation runs a day service. The council is asking us to keep and submit records of staff vaccinations. Is legitimate interest the lawful ground, or is it something else? And do I stop commissioning staff if they're not vaccinated? What do you say to that? Simon.
Yeah, that is an interesting one, Robert. That's exactly the kind of scenario that I was talking about. I'm not sure legitimate interest would be the right lawful basis for that, to be honest. I'd want to refer to the guidance in terms of what exactly would be the right lawful basis for that. I would suspect it might be public interest, or I'm not sure. I don't think it's legal necessity, so it might be public interest. But I'd probably have to check on that. But I think this is exactly the challenge that I was highlighting, really. It's great that Kate's meshes that in. I can see the question now.
And some of the other comments that have come in, again, are back to, in an ideal world, we should have been doing more data protection impact assessments. And clearly there have been that's been a missed opportunity. And I would have said retrospectively that the more that can be done, to have in the bottom drawer in case there's a complaint or an investigation, the better. Out of interest, we are hearing a lot in the media about, no jab, no job. And I know that that there's been one particular company in the Pimlico area, let's say that, who's been quite in the media talking about no jab, no job, admittedly on one occasion from Dubai, which seems strange to me. But do we think that that's really sustainable? What do you think, Joseph?
I don't know if you can legally refuse someone employment on the grounds of whether they've had a vaccination or not, or even they don't have to declare it to you. But I certainly know there's a strong feeling towards that idea, or that you should be refused perhaps service if you haven't had a vaccination because you've taken that choice upon yourself. I just sort of heard that from the community and so on. I think it's a very, very difficult thing to address, but I can see why people would have that attitude.
And I think from a legal point of view, it's a really difficult one. And you, Helen, sort of alluded to this with all of the challenges that we have with people's attitudes to the vaccine, which may be that they don't feel from a religious point of view, or rather that they should take it, etc. And again, we'll get into discrimination, we'll get into all sorts of issues. Moving away from these topics, one of the other things that we're all doing right now is working from home. And we were all mostly thrust into this at the beginning of the first lockdown, when employers were not geared up for everybody working remotely from home, and neither were we as individuals geared up to be in a position to do that. So what lessons have we learnt, and what would you recommend, Joseph, businesses should be doing now, or should have done, in terms of working for home issues and maintaining confidentiality and compliance, etc.?
Well, I think a lot of this has to do with maintaining the messaging. So having regular meetings, or having it part of your all hands or your regular team meeting, and keep planting that seed of privacy and what's acceptable and what the guidance is to maintain awareness of that, because people, especially in the medium to long term, can become complacent with that, or they don't adhere to the policies as much. And if, as many organizations hastily did, put together a work from home policy, try and put some mechanism in place to attest that people have read it and understood it. There's online training courses available. We used some of those internally as well that describe some scenarios. There's some material, and then there's a quiz at the end so that people can interact and actually demonstrate their understanding. You can also be a little bit more sneaky. You can perhaps send some internal phishing emails to see who responds, and that helps keep people on their toes as well. And if people do respond to them or volunteer information, you can then perhaps book them in for further training. But it's really just trying to keep that message going, and the message of what's appropriate with work devices, even though you're in a home setting. So those are the things I would suggest.
Thank you for that. Yes, I can see that the sneaky phishing type approach is useful, but perhaps not some of the things which I've been aware some companies are doing, which is, keystroke monitoring software to work out who is actually doing work and who is apparently not doing work. And I think there are all sorts of problems that will emerge in due course. Certainly, I thought about this when one minute I was in the office and the next minute I'm at home, and I don't perhaps have the world's best shredder. My secretary, who's now working from home, probably doesn't have a shredder at all, but we are doing stuff, and it's not necessarily on the enterprise network. It's not on the server. Our data is not where it should be. And I wonder whether when we get a weaponized subject access request, we're in a position to deal with it. What do you think should be in that work from home policy, Simon?
Yeah, I think that's a really good point there you've raised there, Robert. So I think first of all, organisations might create a specific work from home policy, but let's also remember that they may have other policies that would have potentially covered that. So it might be that they take the approach of updating their data protection policy, their information security. They bring your own device potentially. So what if people are using their own devices, their phones or their laptops for that matter, acceptable use? But I think the key thing is it's important to review the policies that you have, or to create something that specifically covers working from home. And I think, as Joseph said, make sure that people read that. It's really important because there's been a major change. I think we shouldn't forget the information security side, because there has been a growth in cyber attacks. And while people again are at home, I think that is something that we should very much be mindful of, making sure, I think as Joseph suggested with the phishing emails, but making sure that we're advising people of the kind of risks that they might face when they're working from home on that side. And checking, of course, that our technical security measures are up to scratch. So are we, for example, can people access the files remotely, and can they update them, or are they keeping local copies? Have we got VPN access, for example, to allow people to dial in? Do we have two-factor authentication on our emails or on other apps that people are using that make sure that people are who they say they are when they're working from home? But I think some of the other things is just reminding people about the confidentiality and their kind of obligations to be confidential, because that's frankly a lot more challenging when you work from home to be confidential. Because quite often we're used to having work conversations in the office, but when we're at home, people might overhear things, and there might be confidential information that people would hear because we're just working in close proximity to family members and others. So thinking about those kind of things that are discussed on your Zoom calls, etc. And thinking again about documents, and if you print off documents and all of those kind of things as well. I'd also just think about the kind of apps that people are using to access it, because we're in a world nowadays where not everyone's using a small suite of apps. There could be quite a wider suite of apps. And again, if those are either on your own device or ones that the company might have said, nowadays we have all sorts of kind of collaboration apps and things like that. So what's the impact of those now? I would expect that for many organizations, there's been a growth in the kind of apps that people are using to be able to access personal data. Are they secure? Are they being regularly updated? Are they good from a security point of view? Are the patches being updated? That kind of thing we should be thinking about as well. And then lastly, the point that you touched on, Robert, was the monitoring of employees, monitoring keystrokes or other kind of monitoring to make sure that people are actually putting in a day's work, those kind of things. I think employers have got to be quite careful about that because it is a sensitive topic to employees. And I think it's also an area that the ICO has been looking at as a regulator quite carefully and is a little concerned about. So I think, again, as all things, it's important that we're really clear on what is actually necessary and what's proportionate and making sure that we're not stepping over the mark, really.
Yeah, and I think I said this when we were prepping for this, but we have to remember that in the heat of the moment, it's quite possible that somebody will switch between the corporate device and the personal device to do corporate work, and then the personal data is not where it should be, and the controller will have no idea. And so I think there are, a number of risks that need to be addressed. And I wonder, Helen, if I can bring you in here for any guidance that you might have on the whole working from home situation.
To be honest, I think it's been rather covered by Simon, so I don't really have anything further to add.
Okay. So I've seen there's quite a number of things in the chat about organizations' views about things like, we don't want you printing. I've seen a lot of organizations that are saying you will not use anything other than the corporate device. But there was a lot of rushing around to get the corporate device delivered to the homes of everybody that was working there. And I can think how that happened with us as a law firm where we were, shipping extra monitors. Everybody was having to use the VPN. But then, as Joseph said, we did, and we still do, quite a lot of webinars and other forms of training to make sure that we're keeping people safe. Both from a work point of view, but also from their own personal point of view, because we are doing way more digitally. I wanted to get Joseph's attitude to something I heard on a call I was on yesterday with some colleagues in the US, where they were all in Midwest healthcare organizations, and they were saying, although management is back at work, our main workers are not, and we suspect that it will be a mix of attitudes when we go back to work, that some people will still want the flexibility of being in and not being in. I don't know what your views are on that, Joseph.
It's an interesting question, particularly for our firm, because historically OneTrust has been work from work, unless the boiler blows up or something, you're in the office. And I really enjoyed that because I like being in the office, and that was the general rule. And then obviously we went from a step change to work from home. And I think from my experience, there will be a reluctance to go back to that original model because people have gotten used to the flexibility around it. Although we're obviously restricted a bit with COVID problems and so on. People have gotten used to maybe managing their children's time a bit better, or being able to do the school run more efficiently, these sorts of things. So I think there will be a bit of resistance, and I think people will expect a bit more flexibility if they've been able to do their role successfully from home. Personally, I can't wait to go back to the office because I prefer the separation, but I know other people that have perhaps got other things going on outside of work may want to find a balance. So I could see there being some resistance, but I suppose ultimately it's whatever the policy is you'll have to adhere to.
Thanks, Joseph. Helen, any thoughts on that? So you're on mute, Helen.
Yeah, for sure. I think, it is going to be a mixed bag for if people are going to want to go back into the office or if they're going to want to work at home. I do think COVID, has been a transformational impact really on sort of like how people are going to work. And I don't think we'll go back to how we were before. So, I think it will be very interesting to see what people and employers expect of people. So I think expectations on both sides will change.
Yeah, and Simon.
Yeah. Thank you, Robert. Yeah, much the same. I think the business model has changed so much, and there'll be some businesses for which being on site is crucial and vital, and will always be a key part. But I think for many others, there'll be a lot of questioning about how much freedom people should have to work from home, or in fact, there'll be lots of businesses I think that will be built on working from home. Consultancy like ours, for example, we generally work from home when we're not in a client's office, for example. We've had that way of working. It was quite straightforward for us. There was really very limited switch, other than the fact we can't visit clients' offices. But I think there'll be many other businesses that kind of develop, that build on that. And that might have global impact as well, from the point of view that if you're working from home, it's very easy to be working across borders more so.
Yeah, and from my perspective, wearing my hat as a notary public, my role as a notary is to physically identify people, signatures, validate transactions, and that's been a huge challenge where you are remote and where clients do not want to be in close proximity, or you shouldn't be doing it at all. And it's interesting that you're dealing with sensitive data in many cases. Technology is one of the big things that actually helps. And it's where I can see that nothing beats people observing the rule and being trained on the rule, but it's also useful to have technology in the background to help you delineate what's happening, monitoring. I can see that's where, from Joseph's point of view, OneTrust is offering, a good part of the solution going forward. Do you know what you want to add anything to that, Joseph?
Oh no, certainly. And not just around privacy, some of the emerging pieces as well, like ethics and governance too. It gives you, I guess, that sort of flexibility, and being cloud-based, it's accessible, of course, everywhere. So no, I would certainly agree. But it'll be an interesting transition, I think, like it was when everyone transitioned out of the office. I'm looking forward to it personally, but there's going to be a lot of change, I think, again.
Yeah. Okay. Well, I'm going to hand back, I think, perhaps to Simon in a minute to just make any closing remarks and post-webinar admin. We're coming up to the hour, so if I, moderating this, can just thank on your behalf Helen and Joseph and Simon and everybody in the background at DPN for putting this together. And thank you to everybody who's been participating actively in the chats and listening in. From me, thank you, and Simon, over to you.
Great. Yep, I'll keep this short. Thank you very much, Robert, for hosting it very well today. Thanks to my other panel members there. It's been great to hear kind of your thoughts on everything. Thanks to OneTrust for our sponsor, and as you say, Robert, to everyone that's put in some really great comments on that. Shame we didn't have time to do maybe a few more questions, but just for everybody for those that would like to listen again. We will be sending out an email tomorrow that just has a link to the recording that we've got today, if you wanted to do that or share that with colleagues. And again, we'll have other events coming up very soon if you'd like to join us for other webinars. So big thanks to everyone. Hope you've enjoyed it. Hope you found it useful. And bye from us.
Thanks. Bye.
Thanks.
Bye.
Bye.